Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Congenital malformations, Mullerian duct or paramesonephric duct, and we have Wolffian duct or mesonephric duct. These are important. Mullerian duct is forms the internal genital organs, and Mullerian duct appears at 6 weeks of gestation. It originates from intermediate mesoderm, and the left Mullerian duct will form the left side of the fallopian tube, left side of the uterus, left side of the cervix, and left side of the upper two-third of vagina. Similarly, right Mullerian duct forms the same components on the right side. So, formation or development, if you see, first, at 6 weeks, all the fetuses, that is, both in all the fetuses, both Mullerian duct and Wolffian duct are present. At 9 weeks, the Wolffian duct will disappear in females and only Mullerian duct is present. By 20 weeks, internal genitalia are formed in females, that is, the internal genitalia are formed by the Mullerian duct. Formation of various genital organs. Uterus is formed by 10 weeks. Uterine cavity is formed by 20 weeks. Actually, both the ducts, Mullerian ducts, the right Mullerian duct and left Mullerian duct grow towards each other in the midline. There is fusion of both the Mullerian ducts. The fusion of both the Mullerian ducts will start in 7 to 8 weeks.
Actually, there is both Mullerian ducts will be there, two Mullerian ducts, one on each side. Actually, at 6 weeks, there is Mullerian duct and the Wolffian duct are present. But in females, Wolffian duct will disappear at 9 weeks. And at 20 weeks, the female internal genitalia are formed. So there is two Mullerian ducts are present, and the two Mullerian ducts will grow towards each other in the lower part and they fuse with each other. This fusion will begin.
And it gets completed by 12 weeks. Fusion occurs mainly in below to upward direction. Then once the fusion is complete, septa is formed. The septa resolves by 5th month of intrauterine life and a single cavity, uterine cavity is formed. The fundus of the stomach later becomes dome shaped.
The fundus of the uterus becomes dome shaped, and the uterus will form by around 10 weeks, and the uterine cavity will form around by 20 weeks.
thank you and thank you for watching.